Hi, Kinesiology 3010. Welcome to our lecture on physical fitness assessments for adults. Okay, so we're looking at physical fitness because it is critical to activities of daily living, sports, activities, exercise, and we need to be physically active to have a long, healthy life. Okay, so improving fitness can help people improve their health. So fitness level can also help improve athletic performance. So first, we're going to talk about health-related fitness. So what is the fitness necessary to have a healthy life? So this is kind of standard for everybody. Everybody needs some level of physical fitness to live a long and healthy life. Low levels of fitness, as we've looked in our labs, are predictors of early mortality. Okay, skill-related fitness is more focused around sport participation, athleticism, and is more necessary for those. So people, general population, don't have to have skill-related fitness to have a healthy life, but having skill-related fitness is also positive for developing health-related fitness on top of that. So athletes do also have to have a level of health-related fitness as a baseline, and then we can push the skill-related fitness on top of that. So a physical fitness test is there to assess someone's physical ability or how well they fit on these health-related fitness criteria. Okay, so we have different types. We have some for adults, some for youth, some for athletes, some for older individuals, some for people with special needs. There are all different types of physical fitness tests. So we're going to kind of go through them. Most of these tests are some that you did in your labs for this class. So now we're kind of bringing them all together within their purpose to help prepare you for your final project on the statistically analyzing the measurements. Okay, so health-related fitness is the physical capacities that are related to good or improved health and are necessary for activities of daily living and confronting unexpected physical challenges. Okay, so you're able to function well and adapt to your situation or your surroundings. And if you're unable to perform your daily living activities, as well as you're not able to cope with additional stresses or additional physical challenges, you're less likely to have a high quality of life. You're more likely to be injured, and there's more negatives that come with this low level of health-related fitness. The components of health-related fitness are cardiovascular endurance, muscular strength, muscular endurance, flexibility, and body composition. Muscular endurance is aerobic fitness, so thinking VO2 max as our measurement tool. Muscular strength is the maximum amount of force that a muscle or muscle groups can produce. Muscular endurance is the ability to repeatedly contract muscles at a submaximal effort. Flexibility is the ability to move a joint through full range of motion. And body composition is looking at body fat percentage compared to lean mass percentage. Okay, some of the benefits of each is cardiovascular endurance reduces the risk of cardiovascular disease. Okay, it seems like a one-on-one. If you have a better heart and vascular system, you're probably going to have lower risk of heart and vascular diseases. A body composition lowers the risk for cardiovascular disease, diabetes, and cancers, because we know that an excess of adipose tissue puts you at a risk for chronic disease, and a lack of adipose tissue also puts you at a risk for more acute conditions. And then muscular strength, endurance, and flexibility, muscular health reduces the risk for pain, improves functional capacity. It has relations with mortality, in that stronger individuals with more endurance, with more range of motion, more mobile individuals tend to live longer and healthier lives. If we start with cardiovascular endurance, we can look at these through multiple different tests: aerobic capacity, aerobic fitness, aerobic power. But looking at cardiovascular endurance, we're really looking at how well the body takes in oxygen and uses it to metabolize or create energy to perform work or to move. We can measure these against what's normal, and we can also measure them against criteria. So we have two different options here. We can look at what's normal for that group, that individual. We also do have set criteria for excellent cardiovascular fitness, moderate, low, poor cardiovascular fitness. We can assess it using laboratory tests. So for example, here we can look at VO2 max, or the volume of oxygen that they can take in and utilize for energy. Do that on a treadmill or a bike, or swimming, on a rower, moving up to maximal aerobic effort, and looking at gas exchange, so the air taken in from the environment and the air expired, so that difference in oxygen is going to be the oxygen you uptook. It's very direct, it's very accurate, it's our gold standard, but it is time consuming, it's expensive, so we have less capability to perform these tests on a large number of individuals, especially in a short period of time. So there are a lot of limitations here. Okay, we also have submaximal tests, so especially in those who are unable to perform maximal tests. So maybe someone with a heart condition, maybe someone with other pre-existing conditions, or someone with just a really low fitness level that is unable to push to maximum intensity safely. These have relationships with VO2 max because your heart rate is related to the aerobic work that you're performing. So we can estimate, it's not perfect, but we can estimate your maximal oxygen uptake based on what you can use at a submaximal effort. We also have field measurements. So we've done a few of these field measurements. We went through the 1 mile walk. We didn't do any of our runs, just for sake of having everyone be able to complete the assessments. But we use the 1 mile walk, we use the beep tests. These are field assessments that assess maximal oxygen uptake because they are related to what a measurement would be taken from a metabolic cart in a lab. So because we have the validation of these studies, so bringing it back to validity that we talked about before, because they've been validated as related to these same measures, we can assume that those who perform better in the 12-minute run, 1 mile run, 1.5 mile run, 1 mile walk, beep test are going to have higher VO2 max and will score higher if they were to perform a VO2 max assessment within the lab. So we have some estimates here. So those who have high cardiovascular fitness, so those who were up here in the 60s range, how many miles they can run in 12 minutes or how fast they can complete a 1.5 mile run is related to their VO2 max. So we have our estimations, our estimation chart. These are kind of standards. So if you complete 1.5 miles within 12 minutes, you are categorized as a 42 on your VO2 max, which is good cardiovascular fitness. So we can use these as cut points with our populations. So you maybe do the 12-minute run with, or the 1.5 mile run with your students at your high school that you're coaching, or you're the PE teacher for your high school, and you want to know the cardiovascular fitness of the group that you're working with. Okay, here's some cut times that can tell you their VO2 max or their general cardiovascular fitness. We can also use some other field tests like the 3-minute step test. So we would have someone step up and step down on a box. This is lower impact, condensing the space requirements, and then make them perform this at a specific rate. So 56 beats per minute is the YMCA 3-minute step test standard. And then we examine their heart rate for 1 minute after they complete the test. This has been validated in multiple studies, but it has moderate validity. It does not have the same maximal effort component. So it's a submaximal effort, so it has lower validity against maximal measurements. Okay, if we're looking at these heart rates and looking at these standards, we have cut points based on age and sex to which rating will give them for their physical fitness or their cardiovascular endurance. So to be excellent, a male would have to have a recovery heart rate. So the heart rate 1 minute after the step test would have to be between 70 to 78. So if your heart rate is able to come back closer to resting heart rate faster after exercise, that means you have higher cardiovascular fitness. So this is what we're measuring here with the 3-minute step test. We also have the Rockport 1 mile walk. So this is one that we performed for our class. It does have quite high reliability, depending on the study, but most studies will see high reliability between the 1 mile walk test and the VO2 max test in a lab, as long as we are walking as fast as possible and the heart rate is at least 120 beats per minute. If those aren't met, so those basic criteria, it's not a valid test. So there are sometimes some administrative procedures that are required to create a valid test. And then we can use our equation here. It's the same equation you used in your lab. And then we can compare these two standards for VO2 max or standards for those walk times. Okay, so looking at the VO2 max standard, so those who score between 80 and 63 for the 1 mile walk as their VO2 max would be excellent rating. For the college age, and then as we go down further, if you scored a 29 to 20 or 28 to 20, we see that these are very poor levels of VO2 max. Okay, we want to be above average or average to above average, which is about 40 and above. Okay, we can also look at norms for this 1 mile walk time. So if you just want to measure the time it takes to complete the test, to be above the 50th percentile, it takes you about 12 minutes and 40 seconds or 13 minutes and 15 seconds to complete the test. For those who are in the basic college age, general younger adults category. Okay, now let's look at body composition, which is the measurement of lean mass compared to body fat mass. A lean tissue is bone, muscle, organs, and then fat tissue is our adipose tissue, so the triglycerides within the cell, as well as the other functions of fat within the body. The gold standard is hydrostatic weighing. Hydrostatic weighing is where we take an individual, we would put them on this scale you can kind of see in the picture here, underwater. Lean mass is heavier than fat mass, or less or more dense, so it's less buoyant. So you would be heavier underwater the more lean mass you have. You will also displace a certain percentage of the water within the tank. So we know that the buoyance force is equal to the weight of the dispensed water. So we're looking at how much we've displaced. We also look at how much you weigh underwater. And this is extremely accurate because we're using these very specific principles, but there are some issues. So we do need a special facility. It's time consuming. You have to get wet. You have to go underwater. And you also, we do this thing called breathing. If we take in air, we float, which would assume that we have a higher percentage of fat mass, because we would not displace more water, but we would be lighter underwater. So we have to blow out all of our air and down to our reserve volume within our lungs, which is very uncomfortable to do underwater. So you could even try and do it right now, take a breath, and then blow out all of your air as far as you can, and then pretend you're underwater, so hold your breath as long as you can. It's not a very comfortable test. I've done it before. Less than comfortable. You probably wouldn't have grandma or an individual or a child or an individual with special needs performing that test. Some other field assessments that are related, okay, or have been validated against hydrostatic weighing are skin fold measurements, okay, which have moderate to high relationship with the same hydrostatic weight test, but we have to look at proper measurement sites. We have to look at practice. If you ever tried a skin fold measurement, It's very difficult to be a reliable measurer if you haven't taken 50 to 100 skin fold samples. Okay, so if we were to take this measurement, okay, we'd lift the skin, place the caliper, okay, on the skin, and we repeat the process at each site, and give rest interval in between measurements in order to allow the skin, the adipose tissue, and the fluid to all go back to kind of a normal resting state, because as we pinch, we will disperse some of that subcutaneous fat, which can overestimate the leanness of an individual. Okay, so for example, here we have our 4 sites or our 3 sites for the skin fold test. So we would take it from the abdomen, okay, here just lateral to the navel, from the thigh, from the triceps, okay, and from the suprailium. So the ilium is part of our pelvis. So looking at our side here, above the pelvis, almost even to the level of the abdominal measurement. Or we could just use the 3-site abdomen, triceps, suprailium, and skip the thigh, especially if they're wearing pants. It's more difficult to take that measurement. But we would take these from very specific sites, or these specific sites. So we can look. Here's our descriptions of those that we just talked about. We would take the sum of these measurements. So we would sum the 4 measurements and find the median value. So we're looking at, because our median is the most consistent, it's not as affected by outliers. So we'll take the median value, and then we'll plug them into, so our sum of 4, so we're taking the median of each, summing it together, and taking in that individual's age into account. And then this final piece here, this constant, specifies between males and females. So the equation is slightly different because males and females carry body fat differently, so we have to measure them differently. So we're taking the sum of 4, looking at all 4 measurements, and using a regression equation, so a prediction equation, based on the validation, based on the relationship between body fat percentage from hydrostatic weighing and from skin fold caliper measurements. So this is a validated equation to estimate body fat from the sum of 4 skin fold measurements with the inclusion of age. Okay, so then we classify these individuals based on their body fat percentage that we measured. So the classification as only containing essential fat is between 12 to 15 for female and 2 to 5 for male. So this is in an unhealthy category, but this is kind of the minimum standard. Below this essential fat level can be a very high risk for mortality through changes in hormonal structures, changes in cell structures, changes in the nervous system, changes throughout the body. So more acute issues here. We can have the category as athlete or lean, which is 16 to 20% body fat in females and 6 to 13 within males. We can look at fit or normal, kind of our what we would consider normal weight, physically active, fit, is 21 to 24 within females and 14 to 17 in males. Acceptable is 25 to 31 for females and 18 to 25 in males. And then above 32 and above 25 is considered obese. This is the clinical classification of obesity. So BMI is not the clinical classification of obesity, it's just a surrogate measure. So looking at body fat percentage can tell us if an individual is clinically obese, and classified as obese, with that, all of those health concerns that come along with it. Okay, so we can look at these as recommended levels of body fat also by age. So we have the recommendations for in the 20s, 30s, 40s, 50s, and 60s. We begin to store more adipose tissue as we age. So it's likely that normal or recommended body fat percentage may go up with time. Okay, we can also calculate our BMI, our body mass index. You did this in one of your first labs. You're taking our weight and taking our height, using the metric system, kilograms and meters, and looking at our weight divided by our height squared, or the square of our height, to calculate your BMI. Okay, underweight is less than 18.5 on the BMI. So looking here at your weight divided by height squared. So kilograms per meter squared is the units. We just use them as a standard number. To fall into the normal weight category, you have to be 18.5 to 24.9. Overweight category 25.0 to 29.9. Obesity level 1, okay, or class 1 obesity 30 to 34.9. Obesity class 2, and extreme obesity, all based on BMI. So this is just looking at height and weight and creating a classification. A BMI may overestimate body fat percentage in lean people, or body fat levels in lean people or those with a muscular build. BMI may also underestimate fat in older individuals and those who have lost muscle mass. Okay, so those who have sarcopenia, loss of muscle mass, and an overaccumulation of adipose tissue. So we do have to remember this within the BMI, looking at the BMI as a standard. So if someone is fit, athletic, lean, muscular, we have to know that this is probably not the right test for them. They probably would want to use something closer to the skin fold measurement or another measurement of body composition rather than BMI. BMI is relatively reliable and valid compared to, or when using a population of sedentary, physically inactive people. So if you're physically active, BMI is probably not the best assessment for you. So you're hitting that 150 minutes per day of physical activity, plus or more exercise using resistance training, using cardiovascular endurance training, probably not going to be the best assessment for you. But completely sedentary individuals who do not exercise, have low levels of physical activity, like under 10,000 steps per day, probably an easy and reliable assessment for them in their terms of health. All right, I'll see you for our part 2 in a little bit.